Hello, 4-Year CNA fans. This is Miss Patty from 4-Year CNA. And I'd like to welcome you to today's episode of Test Tip Tuesday. Today I want to talk to you about ID bands. This is a pretty hot topic. I get a lot of comments on my YouTube videos about this particular subject. And there's a lot of confusion out there, so I want to kind of clear up some of the confusion about ID bands and testing. Now, ID bands are certainly going to be used in acute care settings. Now, acute care settings are places like hospitals and same-day surgery centers and places where patients are being treated for an immediate health concern, particularly if these patients aren't physically able to communicate effectively. But you don't see ID bands in places like doctor's offices or walk-in clinics, and you're definitely not going to see ID bands in a place that a patient lives. So think like assisted living facilities and places like that. If the patient lives there, they don't need an ID band to let other people know who they are. That's their home. It would be like you wearing an ID band in your home so a visitor would know who you were. It just doesn't make much sense. So you're not going to see ID bands in the majority of healthcare settings. So this causes a little bit of confusion for students. You're taught in your training program to verify ID bands if they're present, but for the test, they're not going to be present because most patients don't have ID bands. So how in the world are you supposed to identify a patient if they don't have one? Well, the same way that you would identify a patient in a doctor's office or in a walk-in clinic. When you go to a doctor's office and you are shown into a little room and they take your vital signs and they ask why you're there and they review your medications and then they leave, when that doctor or nurse practitioner comes in to see you, they don't look at your ID band. They ask you your name, or they will address you by name. They'll look at your chart, they'll look at you, and they'll say a name like Abby Smith. And if that's not you, you're certainly going to speak up and say, no, that's not me. I'm Mary Jenkins. So you are able to self-identify. If somebody calls you a name and it's not the right name, you're going to let them know that that's not you. Now, most patients have the ability to do that. And if a patient doesn't have the ability to self-identify, then that would be something different, something special, and something that would be written in the care plan to address that particular patient's needs. So if you have a non-communicative patient, in the care plan, it's going to tell you how to identify that patient. It may be a picture, it may be an ID band, but the care plan is going to tell you specifically how to identify that particular patient in that setting. For the test, you don't have to use an ID band. You're not going to pretend one is there. You're not going to look at their wrist, nothing like that. You're just going to address them by name, and they'll let you know whether that's them or not. So I hope this cleared up some confusion about ID bands and the test. In a clinical setting, certainly if you have ID bands like a hospital or a rehab center or a same-day surgery center, then you're going to want to use those according to your facility policy. But whenever possible, even if there's an ID band on, you should always ask the patient to tell you who they are, because it's amazing how many times those ID bands are wrong. And that could be really, really scary and lead to some really big medical errors. So if your patient can talk, get them to tell you who they are. So I'd like to thank you for tuning in to today's Test Tip Tuesday segment, and make sure you tune in for our other weekly specials as well. Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and Career Spotlight Saturday. We'd love to see you at each one of those. If you like this video, give us a thumbs up and subscribe. Make sure you hit that bell for notifications, and YouTube will let you know every time that we post a new video in these series. Leave a comment below if you found this helpful, or if you have a story related to an ID band that you want to pass on. We'd love to hear from you. Thanks for tuning in. Until next time, happy caregiving.